Health sociology bridges the gap between societal structures and individual health outcomes, offering a nuanced understanding of how social factors influence health, illness, and healthcare systems. By examining the role of culture, economics, politics, and social norms, it sheds light on systemic inequities and informs strategies for improving health and well-being. In this video, we will look at 10 key concepts central to this field, each illustrating a unique aspect of the relationship between society and health. The social determinants of health encompass factors such as income, education, employment, housing, and social support networks. These elements shape opportunities and access to healthcare, profoundly impacting health outcomes. For example, individuals living in poverty often face food insecurity, limited access to preventive care, and higher exposure to environmental hazards like pollution. Addressing these determinants requires policy interventions, such as improving access to education and affordable housing to create healthier communities. Health inequality focuses on the unequal distribution of health outcomes across different social groups, highlighting the systemic barriers that perpetuate disparities. These inequities are often rooted in structural racism, gender bias, and economic inequality. For instance, racial minorities in many countries face higher rates of diabetes, heart disease, and infant mortality due to a combination of discriminatory practices, inadequate healthcare access, and stress from social exclusion. Reducing these inequalities requires systemic change, including equitable healthcare policies and anti-discrimination measures. Medicalization refers to the process by which normal life experiences or social problems are categorized as medical conditions. This can lead to overdiagnosis and overtreatment while potentially stigmatizing individuals. For example, conditions like attention deficit hyperactivity disorder, ADHD, and anxiety disorders have seen increasing rates of diagnosis, sometimes raising questions about whether societal pressures contribute to their classification as illnesses. While medicalization can validate people's struggles, it also risks reducing complex social issues to biomedical terms. The social construction of health and illness argues that our understanding of health conditions is shaped by cultural beliefs, norms, and historical context. For example, what is considered a mental illness can vary widely across societies and change over time. Homosexuality, once classified as a psychiatric disorder, is now widely recognized as a natural variation of human identity in most parts of the world. Understanding health as a social construct encourages sensitivity to cultural diversity in healthcare practices. The concept of biopower highlights how modern governments regulate populations through public health campaigns, medical practices, and societal norms. This can be seen in vaccination programs, fitness campaigns, and even wearable health technologies that monitor individual behaviors. While biopower can improve public health outcomes, it can also raise ethical concerns about privacy and autonomy. For example, mandatory health screenings in workplaces might benefit overall health, but may feel intrusive to employees. Healthcare access and utilization examine the systemic barriers that prevent individuals from receiving adequate care. These barriers can be financial, geographic, or cultural. Rural populations, for instance, often struggle with limited healthcare infrastructure, leading to delays in treatment for serious conditions. Additionally, marginalized communities may encounter biases within healthcare systems, discouraging them from seeking care. Efforts to improve access must address these challenges through policies like universal healthcare or culturally sensitive provider training. The concept of the sick role describes the societal expectations placed on individuals who are ill. While they are temporarily exempted from responsibilities like work or school, they are also expected to seek treatment and strive to recover. Deviating from this role, such as not seeking medical help, may lead to judgment or exclusion. This concept highlights how societal norms shape individual experiences of illness and the collective responsibility to support the sick. Global health disparities focus on the differences in health outcomes and healthcare access between high-income and low-income countries. These disparities often result from economic inequality, weak healthcare infrastructure, and political instability. For example, malaria remains a leading cause of death in sub-Saharan Africa, while it is nearly eradicated in wealthier regions due to better prevention and treatment options. Addressing global health disparities requires international cooperation and investments in global health initiatives like vaccine distribution. Stigma surrounding certain illnesses or conditions can negatively affect individuals' mental and physical health by discouraging them from seeking care or disclosing their conditions. For example, individuals living with HIV/AIDS often face societal judgment, which can lead to isolation and delayed treatment. Similarly, mental health conditions like depression and anxiety are frequently stigmatized, affecting help-seeking behavior. Public awareness campaigns and education are crucial to combating stigma and fostering acceptance. Health behaviors and lifestyles refer to individual choices, such as diet, exercise, smoking, and alcohol consumption, that affect health outcomes. However, these behaviors are heavily influenced by social and economic contexts. For instance, low-income individuals may lack access to healthy foods, leading to higher rates of obesity and related illnesses. Public health interventions, such as subsidizing fresh produce or creating safe spaces for exercise, can help promote healthier lifestyles across communities. Health sociology offers critical insights into the complex relationship between society and health, revealing the systemic and cultural factors that shape health outcomes and healthcare systems. By understanding concepts like social determinants, health inequality, and stigma, we can better address the root causes of health disparities and create more equitable healthcare solutions. This field underscores the importance of integrating social perspectives into public health strategies to improve individual and collective well-being. Stay tuned for more insights into business and the social sciences. If you found this overview helpful, don't forget to like, subscribe, and comment on future topics you'd like us to cover. I'm Dr. Dog, wishing you a fantastic day ahead.